coming up next. As you can see, we're going to have some patient stories. And while they're coming up, let me just tell you a little bit about this. We're very excited to have a session with voices from real people and their experiences with electronic health records. No, I know you do.
Governance of the Nationwide Health Information Network.
Go for it. No, thank you so much. Patient privacy rights, of course, puts patients first. And so that's why these early sessions today are going to focus on real stories and real people and what happens to them. On my far right is Julie. She is going by her first name, Julie P. She is going to tell you her personal story.
Morning, my name is Julie, and I'd like to thank Dr. Peel and PPR for inviting me here today and giving me a chance to tell my story. I'm a little nervous because it's very personal, so please bear with me. First, let me tell you a little about myself. I've lived for over 30 years in Boston, Massachusetts. I have a wonderful son who's a junior in high school now. Professionally, I'm an attorney, and I've dedicated my career to public service and to helping people. I have very good health insurance and very good doctors, and in my area, there are top-notch hospitals and specialists, so I feel very fortunate to have been receiving very good medical care all these years. My health has also been very good in general, with one exception. I do have one major illness, and it's bipolar disorder. I was diagnosed in my early 20s, and I've learned to manage it well. But I've never told many people about it, well, until now. Only my closest friends and family know about it. And the reason for that is that the stigma is so great. There's a lot of misunderstandings and discomfort, unfortunately, and also even fear in some cases because people just don't understand mental illness and what it is. And unfortunately, this extends to the medical profession. So now I'm going to tell you my story and what happened to me. In the last several years, the majority of my doctors have joined a network called Partners Healthcare. Over the past few years, it has grown expansively. Now, thousands of doctors share electronic medical data, and this has been true in Massachusetts, I think, since 2003. Both my primary care physician and my gynecologist are part of the Partners system. Also, I was seeing a psychiatrist for medication management and for psychotherapy. When I first started seeing them many years ago, I was guaranteed that my medical records were private. Especially, I felt confident that the therapy notes would not be released by my psychiatrist to anyone without my consent. In 2008, I decided to switch therapists and to have my primary care doctor manage my medication, which she felt very comfortable with. While she was away on maternity leave, I had an emergency. I thought I had appendicitis. So I went to see a stand-in doctor, and I've never seen this doctor before. I've never met him before. So instead of properly examining my stomach, he asked me if I was seeing a psychiatrist. He told me that he didn't feel comfortable refilling my medication. He basically gave me a 10-minute lecture about how I should immediately find a psychiatrist. So I was pretty shocked when this happened, and it's never happened before. So as it turns out, I found out that there were over 200 pages of therapy notes in the Partners database with very specific and intimate details that took me years to disclose to my own therapist. I also learned that this information was available to all my doctors. So now I'm going to read you a few snippets because, you know, when I tell my story, I don't think people realize what kind of information is in there that's allowed to be shared without the patient's consent. And these are from my actual records, and they're quotes. Uncovering past traumas, sexual abuse by boy in preschool. Son still has some pain, but is going to school. Patient is looking to change her job. Problems with family continue. She and her mother are not talking. Mood seems better, less depressed. She has defaulted on student loans and has begun to deal with this, including consulting an attorney. Therapy consisted of discussing past relationships, family problems, and job issues. Previous sexual abuse by father's friend discussed in detail. So when I realized that a doctor I didn't even know read these notes, I felt violated. Psychologically, I was re-traumatized. I was kind of pretty, upset for a long time. I've never felt comfortable telling anyone about this, not even my closest friends, only my therapist. So how could this have happened? I thought it was a mistake at first, so I wrote a letter asking partners for an explanation. The privacy officer at Mass General Hospital affiliated with Partners assured me that they have many safeties in place, especially when it comes to mental health records. But she also wrote, quote, "If we were to restrict all mental health information, we would be doing a disservice to our patients in that their physicians would be working with an incomplete set of data. It may be important for a cardiologist or even a dermatologist to be aware of psychiatric symptoms." I was horrified. I filed a complaint with the U.S. Office of Civil Rights. I sent them copies of my actual records because I thought this agency could help. This is the response I got from the Office of Civil Rights. Dear complainant, OCR will not be able to accept your complaint for investigation. Your allegations that psychotherapy notes and other unnecessary information is included in the electronic medical record system and accessible to unauthorized parties, even if fully substantiated, would not violate the privacy rule. Under the privacy rule, a covered entity determines which information is necessary to be included in a medical record and accessible to permitted parties. A covered entity is required to adhere to its own standards. So I didn't really know where to go after getting that letter, so I asked my doctors for help. Especially distressing was a letter from my primary care physician, she's a great doctor. It took her 8 months to give me her privacy policy in writing. Here's what she wrote. Dear Julie, after a discussion with our administrative director and our HIPAA consultant, I was informed that we cannot restrict anyone from your records. Electronic medical records are now mandated by federal regulations. If you continue to receive care within the partner system, we would need to continue to use the electronic medical records and would not be able to restrict other providers from having access to it if needed to provide care for you. So basically, if I didn't agree with this, I'd have to give up my doctors and go somewhere else. Why do I have to give up my doctors that I've had for many years? I really like my doctors. That's just not right. In addition, there were errors in my records, such as medication dosage. I was told it was a quirk in the system. It took my doctor several years, literally, I think it was 4 years, to get that corrected. Finally, after several months of complaining and letter writing, Mass General did restrict the old therapy records. However, I was also told that any future records will not be restricted. In other words, the minute I see a partner's doctor again, the whole process starts over. So where am I today? Now every single time I need medical help, I have to weigh carefully the urgency of my medical needs versus my privacy concerns. For the first time in my life, I've seriously considered lying to my doctors or simply omitting the details that I didn't want others to read without my consent. I want to feel safe again, talking to my primary and to my gynecologist and to my therapist about the issues that I need to talk about. Right now, there is no safety. I'm glad that a bunch of privacy experts are gathered here today. The technology allowing doctors to share electronic medical records brings with it a monumental improvement to patient care. I also know that the technology is advanced enough right now to safeguard patients' individual privacy needs. And I hope that policy and law can catch up with that technology sooner rather than later. There are many of you here in this auditorium. I don't know any of you. I did share some very personal information with you, but I'm here by choice. I chose what information I wanted to share. Believe me, there are over 200 pages of notes that I opted out of sharing with you today. But now I know that anything I say to my doctors will be available to many clinicians and others when I seek medical care in the future. Most likely, that will be many more people than the number of people in this auditorium. Ultimately, I'm the one who cares about my health the most. It's in my best interest to have my doctors have the necessary information that they need to treat me. I should be the one who makes these decisions together with my doctors. It should never happen without my consent. Thank you.
Julie, thank you so much. We really appreciate you coming forth to tell everyone what happened to you. We were really pleased that Julie would agree to come, because it's so important to know what kinds of things are happening with electronic systems, and she's the reason that we're here. She's the reason that we're having this summit. She's the reason that patient privacy exists, is to try to see how we can find solutions that protect privacy but allow people to benefit from electronic health records. And so she's raised a lot of important questions, and I hope that you'll think about her story today and tomorrow as you listen to the other panelists and, you know, after you leave from here, because the questions she raises are the ones that we all, I believe, want to solve together, and that's why you're here. Julie, we're very, very grateful to you. Thank you so much for being so candid and brave. So, okay. And I hope you'll stay with us through the summit. I think people would really like to talk with you more. We have about 5 minutes where the first plenary panel is going to come up, and we're really going to, this is going to be led by Andrew Dillon, who's the chair of the University of Texas School of Information, and we have some great panelists who are going to talk further about the kinds of issues that you heard raised by Julie and by the other stories that were told in the session that we're calling First, Do No Harm, Does Technology Harm Patients? So I'm going to put up the tents, and I hope the speakers and the moderator will start to move forward. You can stretch your legs a minute, but in between, we're going to do this in between each session because it takes a few minutes to get everything set up. So